The broadcast is now starting. All attendees are in listen-only mode.
Good morning and welcome to our July Dementia Dialogue entitled First on the Scene. My name is Heather. I'm the Outreach Senior Manager here at Banner Alzheimer's Institute, and I'll also be facilitating our discussion today. Throughout 2018, we have been in a pursuit of answers with our webinar series, where each month we are tackling a different question related to caregiving of a person with dementia. And I think this month's topic is particularly interesting. We're going to be looking at what can I learn about dementia from people who respond in crisis. And I think this is a valuable topic because first responders go through special training and they're put in extenuating circumstances where they need to know how to respond to all different types of people. So what lessons can we take from these individuals? I'm pleased to introduce our expert today, who is Tracy Wilkinson. Ms. Wilkinson is employed by the Scottsdale Police Department as a crisis intervention specialist. She is the supervisor of the Scottsdale Police Crisis Intervention Section. The program staff primary duties include responding to police officer, private citizen, school, and social service agency requests for behavioral health, sociological, and victimization services in areas such as mental health emergencies, domestic violence, sexual assault, child maltreatment, death, and dying. Ms. Wilkinson is also the coordinator for the department's Crisis Intervention Team, or the CIT program, and a partner of the East Valley CIT program collaboration. Ms. Wilkinson is an appointed member of the Arizona Supreme Court's Committee to Impact Domestic Violence and the Courts, a member of the Arizona Coalition for Victim Services, and the Association of Threat Assessment Professionals. She has served as a subject matter expert for AZ Post, Arizona Peace Officer Standards and Training Board, in the areas of domestic violence and mental health. Welcome, Tracy. Thank you so much for being here today.
Good morning. Thank you, Heather.
So let's just jump right in. And I have a feeling I might have used a term that our listeners are not very familiar with. Can you explain to us what is the CIT training program that I referenced?
The Crisis Intervention Team is actually much more than training. It is a program. A CIT officer will go through 40 hours of specialized training, but beyond the training, one of the most important parts of the CIT program is that community collaboration. The CIT program is a voluntary program for officers to participate in. It's a specialty, just like not all officers learn how to ride the motorcycles. Not all officers are SWAT trained. We want officers that are interested in that CIT program. The initial training consists of 40 hours, and there are about 26 training sessions within that initial training. Of those 26 sessions, probably only about 3 are taught by law enforcement officers. Most of them are taught by community professionals and persons with lived experience.
And I think my exposure to the CIT program, I have been working with you and with other CIT programs throughout the Valley to bring the Alzheimer's voice to it. But what other topics are covered in this program?
Some of the other topics are understanding psychiatric disorders. We also talk about intellectual and developmental disabilities, including autism. We talk about suicide, working with individuals with PTSD. So a large focus on behavioral health and mental health, and including substance abuse issues and homelessness as well. We really want to give the officers some more tools and to help them understand some of the signs and symptoms of mental illness and co-occurring disorders, and then how to de-escalate so that they can bring some calm to the situation, get somebody the appropriate resources, and provide some assistance.
And so What do CIT officers do with this training? Is this just another level that they have in their training repertoire? Are they called into crisis situations? How does that work?
They might very well be called in. Say, for instance, we have someone who is suicidal. The officer may hear that dispatched, or the dispatch may specifically send a CIT officer, the sergeant or the lieutenant, or perhaps we learn of an individual who has dementia and is struggling with Alzheimer's. And again, that CIT officer might be the one to respond, work with the caregivers, and also provide some assistance and referrals when appropriate.
Mm-hmm. I have seen the agendas for these training programs, and I each time get 50 minutes, though I keep asking for 4 hours. I'm not getting it. But the 50 minutes I'm very grateful for, and the agenda is just packed with so many different topics. But what I think is incredibly powerful about this is I get to talk about Alzheimer's disease, and they can process that and learn good communication strategies. But then at the end of the week, they go through sessions where they actually experience what it's like to have dementia. Can you explain that a little more?
Yes, on Friday, after their full week of instruction and learning about individuals with dementia or mental illness or PTSD, on that last day they experience 6 scenarios. And one of the scenarios that we have included in the East Valley CIT program is the virtual dementia tour, so that we have the officers go through that exercise. It's very impactful. And then after going through that exercise, then oftentimes the next scenario that they go through is responding to an individual with dementia. During that role play, they are evaluated by a CIT officer who has previously participated in the program and gone through that training. They are also evaluated by a professional mental health practitioner or a behavioral health practitioner. And then the role player also provides some input to them, giving them some new skill sets, helping them learn from those experiences, and then be able to put it in practice back on the road. And I also want to share that beyond that 40 hours, we also have continuing education throughout the year. And Heather, yes, we were able to bring you to Scottsdale. I think it was last year.
Yes.
We gave you those 3 hours. And because some of the individuals might have gone through that training 10 years ago.
Right.
And we really want to be able to provide them with new perspectives and new training, and also to learn more about the resources that are available in our community.
And this is not just a Scottsdale training program. This is much broader.
It is actually international. The CIT program began in 1988 in Memphis following an officer-involved shooting. And then the Memphis Police Department, the University of Memphis, and NAMI got together and created that curriculum. In Maricopa County, we have a very vibrant CIT program. We have the East Valley CIT program collaboration. There is another program on the West Valley, and then Central as well. So a number of officers throughout our Maricopa County area, and again, nationally, are trained in the CIT program.
Mm-hmm. And I appreciate, I know when I go there and go through my 50-minute session, I'm talking about how do you identify a person with dementia? What does the progression look like in them? And I actually use some of the materials from the International Association of Chiefs of Police, which they've developed what they call talk tactics, which is, sometimes it's easier to remember strategies if we put it into an acronym.
Very much.
I detailed those in the recent Beacon newsletter, where the T is take it slow, A is ask simple questions, L is limit reality orientation, and K is keep eye contact. And I get to go in depth explaining what each of those are. I think the important thing to remember is you had mentioned if someone needs to call law enforcement regarding a person with dementia, you can say, is there a CIT officer available, correct?
Yes, you can certainly request one, and if they are available, they may very well be the one to respond to your residence, to the household, or wherever that call may be initiating.
Perfect, and I think that really brings us to the next question that I wanted to ask you about, and I've encountered this many times. Interestingly, We had a family call in and ask us this very question. They were having a crisis with their person with dementia, and they needed to call first responders, but they didn't know, should they tell first responders if this person has dementia or not? What are your thoughts on that?
There is no shame in having dementia. If you had a family member that had diabetes, you would not hesitate letting those first responders know that that person was having a diabetic crisis, was needing some medical attention. So too, we ask that you let us know when you're calling that first responder that your family member, the person you're providing care for, has a problem with dementia or another cognitive disability or disorder. The more information that first responders have, the better we are able to respond. And using literally some of those talk techniques, being very careful not to ask repeated questions over and over, multiple questions at one point at a time, taking it slow, de-escalating, and providing some comfort to those caregivers and the individual with dementia. So please let us know. That would provide us the best tool set to respond.
Mm-hmm. And I again reference the training that I do with the crisis intervention training program, where we're very careful to differentiate. You know, often you don't, with dementia, it's a different skill set than even say you're responding to someone with a mental illness. And so it's so important that officers have that information so they don't start chasing one direction, not realizing actually this person has dementia, and potentially causing more problems because they didn't have that information.
Very much so. And I was looking at one of your Beacon newsletters earlier, and I think it talked about therapeutic fibbing. And sometimes you have to do that to de-escalate. And ultimately, we want to make the person more comfortable and reduce agitation, reduce confusion. And sometimes that is a tool that is very helpful.
Mm-hmm. So I want to move on and talk more broadly about what's happening in the world of law enforcement and first responders. Are there any initiatives or supports within this arena to keep a person with dementia safer?
Along with the Alzheimer's initiative that the International Association of Chiefs of Police created, a number of agencies throughout the nation and certainly in Maricopa County have initiatives. One that we are utilizing certainly is the Medical Alert and the Safe Return, and partnering with the Alzheimer's Association for that. We also have, for instance, in Scottsdale, and as early as 2006, we created or partnered and have the First Responder Smart Card program that provides a way for family members and caregivers and individuals with a mental or cognitive challenge are able to provide the first responders, provide law enforcement with some information so that, again, officers have that information when they're responding perhaps to that residence or responding to that individual out in the community.
Mm-hmm.
Chandler Police Department, as well as Mesa Police Department, has the similar registration programs, and I would suggest that our listeners today contact their local law enforcement agency and what sort of tools do they have to register someone, to provide law enforcement with that information. And certainly one of the great tools that you recently shared with me was your card.
Yes, we have put together an information card, and again, if any of our listeners are interested in getting that, you can request that on our website. But the information card was put together to help you think ahead about maybe some details in case your person wanders. Understandably, if a person with dementia wanders, you as the caregiver are probably not going to be in the best frame of mind. And being able to think through maybe recent details of things that have happened. So the information card gives you the opportunity to compile all of these details together ahead of time. In case they wander, you can hand this to first responders. It goes through things like the physical description of your person, but then we get into more dementia-specific type questions. Has your person been fixated on anything recently? That could be helpful if maybe they've been talking about going to work quite a bit lately. That will give first responders a clue if maybe they should go and check a previous place of employment, or were they talking about a home that they used to live in. We also have you consider questions like, will they respond well to law enforcement? If someone in a uniform is looking for them, is your person likely to step forward and respond well to that, or do we need someone who's more in plain clothes? The same for, do they respond well to males and females? All of that is helping first responders put together details to be most effective when they're looking for a person with dementia who's wandered. So thank you for bringing that up. What about the Silver Alert system? That's relatively new in Arizona.
Yes, the Silver Alert system was put into legislation in Arizona in 2014. It is administered by the Department of Public Safety, and you've probably seen sometimes as you were driving through the freeways, some of those alerts on the boards over the road. There are about 100 such signs in Maricopa County on our freeway system.
Wow. I feel like it's almost weekly that I see one of the Silver Alerts up there.
Just this week, in preparation for this, I was going on the Department of Public Safety website, and it shows some of the history. And you're right, nearly every week it seems that there is another alert. Mm-hmm. And there are some criteria for those alerts. So there are certainly occasions when individuals wander that are not included on that Silver Alert dissemination of information.
Okay.
In order for the Silver Alert to be issued, police must have first of all taken a missing persons report, and they must have exhausted all other resources prior to doing that. In part, we don't want people to become so accustomed to seeing these Silver Alerts that it doesn't provide a resource anymore, or it's just here we go again. And then that person with that Silver Alert, we want to have some information available so that when that information goes out to the public, that it really will be helpful in their locating the individual. And that's why so oftentimes you'll see the type of vehicle description and the license plate number included on that Silver Alert information.
Okay. Speaking of Silver Alert, this just segues perfectly into the next topic of conversation that I wanted to bring up. Nearly 2/3 of people with dementia will wander at some point in time throughout the course of the disease. What would you encourage caregivers to do if their person does wander?
Contact the police right away. If you contact the police, we can have more eyes on the road looking for your loved one. If you're out there driving around, that's 2 eyes. And then if they return home, then you will miss seeing them there. Give us a call. Give us all the information that you have. Again, ideally, you've done sort of that crisis planning ahead of time, filling out the card. Have the license plate number written down ahead of time. Have the type of vehicle written down ahead of time so that you can have that. Oftentimes when we're in a crisis, we just don't think clearly. And I surprise myself sometimes. I'll be shopping with a friend and I'll think, oh, I've lost them in the store, and I could no more tell you what they were wearing prior. So we want to plan for these things ahead of time. Give us a call. Oftentimes that individual is found within miles of their residence, if they are on foot. If they are driving, it may not be until they run out of fuel.
I think especially if someone with dementia wanders, as a primary caregiver, there's a lot of guilt. You take a lot of the blame on yourself for that happening. And so I think that impedes caregivers from reaching out for help from first responders.
Very much so. And we understand that you cannot literally have them in eyesight 24 hours a day. You might have to go put a load of laundry in the washing machine, check something on the stove. Some individuals and families that I work with maybe will have an alarm system on the door. So when that door opens, you'll hear a ding ding. You might, if you're comfortable with your neighbors knowing, if they see your loved one outside in maybe their pajamas, have them let you know right away that that's, or at an hour when they are not normally outside. So those are some things that kind of plan ahead of time.
Mm-hmm.
Also, it's important to have a recent photograph of your family member to share with law enforcement. And then there are a number of ways that we can get out that information. Sometimes it might be a reverse 911 call. It might be to share that photograph with all the other officers driving around.
Mm-hmm.
So there are a lot of resources and work that we can do that doesn't include the silver alert, but helps us to perhaps locate that wanderer.
You know, I had a caregiver who they used to take a selfie with their person every day. And so it was just like an occasion. And then they had the outfit that the person was in just always readily available. But it was something kind of fun. Oh, we're ready for the day. Every morning we take a picture.
And I like that idea very much. And when we look at the medical alert, sometimes that's another way to kind of sell it to your loved one. We will both get the medical alert. And then it's not like somebody is being singled out or that they have a disability, they have a disorder, they have those struggles. We're doing this together. And sometimes that's an easier way to sell it.
Definitely. So I want to move on to another topic that I know is a real challenge for caregivers. And, you know, we offer classes on this, and I've seen a lot of publications on it, but I'm really curious from your perspective, Tracy, what should caregivers know about driving with dementia?
It is, I think, one of the greatest challenges that family members have to encounter with their loved ones. If you can have that discussion early before it reaches a crisis, maybe talk about when is it time to, quote, retire from driving. You've retired from work, maybe some other things you aren't doing that you used to do, maybe having that conversation ahead of time. It may come to a point when family members have to disable a vehicle and take some of those larger steps, or make some of those plans for alternate transportation, whether it be the cabs and some of those other parts, so the individual doesn't feel like they've lost their independence to go out and to do things. Oftentimes it's that partnership with the medical professionals. I understand that it is great difficulty for a family member to say that their loved one should not be driving anymore. And sometimes hearing that from a medical professional may provide a little bit more buy-in for the individual that shouldn't be driving anymore. Also, family members do have the option of reporting to the Arizona Department of Transportation as a concerned citizen and asking that the individual perhaps be reevaluated for driving. Your medical professional can do that as well, and that does not violate any confidentiality. They can do that through the Department of Transportation, and law enforcement can also request a retest for individuals, or that they have that a medical review, if you will.
Okay. And so if a caregiver wanted to call in and request that, would their name be attached to it? If it came back to the person, now they're being summoned to be retested, do you know if they would know who reported them?
The information literally is subject to disclosure in accordance with state and or federal law. The form is actually online at the Arizona Department of Transportation, so I would suggest individuals look at that.
Okay.
And again, maybe they need to be talking with that medical provider and have them do that instead. It might just be a little bit easier. Plus, they will have the clear diagnosis information to do that. But it's just another tool for individuals, another resource for them if they need to perhaps go to that next step.
And I completely agree with you about you needing to partner with your medical professional. I know our clinicians at Banner Alzheimer's here are often having that conversation about driving, writing letters, those sorts of things to support an individual not driving anymore. We are fine being the bad guy in the situation. What's so much more important is that you as a caregiver are on your person's side and they see that you're on their side, not that you're trying to work against them in any way. And so let us be the bad guy in the equation.
And sometimes I'll ask law enforcement and some of our officers to also submit somebody for that retest. Again, let us be the bad guy.
Right.
We observe the driving, and it's a little bit easier for us to be able to do that then.
Mm-hmm.
And sadly, the consequences of an individual driving when they should not medically be can be very tragic.
Mm-hmm.
Oftentimes, you'll hear the media stories about an individual that is driving and they got off the roadway, ran out of gas, died from exposure, or perhaps were in a auto collision.
Mm-hmm.
And sadly, we have to do what is in our power to stop someone from driving for their own safety and the safety of other community members as well.
Right. I know, a really, really challenging topic, though, for caregivers and the person to look at. I like how you put it, retire from driving. So we just have a couple minutes left, and one last question. Do you have any general safety strategies that you could share with caregivers? I know earlier you had mentioned potentially putting an alarm on the door. If someone is about to wander, at least you have an auditory notification that the person might be leaving.
And some individuals I know just don't want to be any part of the medical alert system. But there are watches, for instance, that have a band with a family member's name or number. A lot of runners utilize that.
Yeah.
So somebody who's out and about, that might be an option. Again, the photographs, I really encourage filling out that resource card, looking at your law enforcement agencies, participating in their registry program, and certainly find your support.
Mm-hmm.
There's a lot of times that working and living with an individual with dementia can create quite a challenge. Take care of yourself. Have some of these resources in place for yourself ahead of time.
Great. Thank you so much. I think we covered a lot of really good information today, Tracy. Thank you so much for spending a little time with us this morning.
Oh, it was my pleasure. I'm very glad that you asked me. Thank you.
Yes, and sharing your expertise with us. And thank you to all of you who joined in to our webinar this morning. I would like to invite you to join us next month as we discuss eyes and ears and mouth and nose. The question we're going to be tackling is, when it comes to supplementary medical care, what is necessary and how do I make it simple? This is looking at dental appointments, eye appointments, colonoscopies. Are these appointments still necessary? And if they are, how do we make it as easy on you and your person as possible? So I hope you can join us next month for that on August 15th. Thank you so much for attending our Dementia Dialogue today. I would encourage you to use your voice after today's session to let you know what we thought. You will be emailed an evaluation. Please take a few moments to fill that out. Share with us some ideas of other topics you'd like to learn about, because we create these discussions for you to meet your needs. A reminder, this session has been recorded and it will be housed on our website so you can reference it in the future. Thank you so much for attending the Dementia Dialogues, where we bring the dementia education to you.